Hello, you are welcome back again. Here, we'll be talking about the role of a medical lab technician, the role of a medical laboratory technician in a diagnostic healthcare center. But firstly, who is a medical laboratory technician? A medical laboratory technician is a person or health professional who has undergo a 3 years training in a school, in a college of health science and technology, under the supervision of a medical laboratory science council of Nigeria, which is the governing body. Once the 3 years course is completed, then all persons who have passed the examination will be given a certificate to certify that you are a licensed medical laboratory technician. I don't know if I'm too fast. That certificate qualifies you to go out and work. And before giving the certificate, you will swear an oath to abide by the rules of the Medical Laboratory Council, Science Council of Nigeria. And you must, by all means, learn to be secretive, because you must learn to keep the secret of your clients. If not, if any secret is exposed, you will be penalized. Now, what is the role of a medical laboratory technician in a diagnostic healthcare center? One, we have the pre-analytical stage. We have the analytical phase, which is stage. Then three, we have the post-analytical stage. The first one, the pre-analytical phase. The laboratory technician in a comprehensive healthcare system has the role in pre-analytical stage. And the role of a medical laboratory technician in a pre-analytical stage is that a laboratory technician is responsible for sample collection. You first of all collect the sample, you label the sample, then you must register the sample. Any sample without registration, without labeling, cannot be used. Why? Because we don't know if it belongs to the patient it belongs to. So you have to be careful. As a medical personnel, you have to be very careful in all of these things. That is the first one. Like I said, the first one is sample collection. Once you collect the sample, you label the sample, then you register the sample. That is the pre-analytical stage. The pre means before. Then the second one is the analytical stage. The work, the role of a medical laboratory technician in the analytical stage is that a medical laboratory technician, they are responsible for laboratory tests such as the red PCV, which is packed cell volume. You can do the blood grouping, the clinic test, malaria test, the typhoid test, HIV test. All those simple tests, they are under the analytical stage. Now, this brings us to the post-analytical stage. The, the role of a medical laboratory technician in the post-analytical stage, after the sample must have been analyzed in the lab, a medical laboratory technician is responsible for registration of sample in the register. Once they are done with everything, the scientist is done with the post-analytical stage. Either you, but must be under the supervision of a scientist or medical lab scientist. Your work is that you are responsible to register the sample. You are supposed to register the sample in the laboratory register so that whenever the patient comes back in the future, once you go back to the register, you know that the history of the patient is still there. And from there, you can print the results. I hope with all these 3 points that I've given you, you know that medical laboratory technician course is as simple as what you can think of. Please, if there's any question you need to know, or if there's anything that is confusing, you can ask me. Like I said, I'm here to explain to you. Don't forget to study what I've said, because some of these questions, they come out. In fact, it always comes out in the council exam. We have the pre-analytical stage, we have the analytical stage, and the post-analytical stage. In summary, the pre-analytical stage is whereby you, as a technician, the first thing you do is to collect the sample. Once you collect the sample, you label the sample, then you register the sample. The second is the analytical stage. In the analytical stage, the work of a medical laboratory technician is to perform some simple tests such as the packed cell volume, which is PCV. You can run HIV test, the malaria test, the RDT, rapid diagnostic test. You can run the clinic test, all these strip tests, like pregnancy tests, HIV, hepatitis B, hepatitis C, name it. That one is under stage 2. Then the last one is the post-analytical stage. There, after the sample must have been analyzed, a medical laboratory technician registers the sample in the registration book before the result is given to the patient. Thank you so much, guys. Please don't forget to subscribe and turn on the notification bell so that whenever I post new videos, you'll be the first to be notified. Please don't forget to drop your question in the comment section. Thank you so much, and bye.